Welcome to the Chatham-Kent Health Alliance Emergency Department. There are 2 sites to serve your healthcare needs. Both are staffed by dedicated and compassionate personnel that provide quality care to all their patients. Our healthcare team includes specially trained physicians, nurses, and support staff. We also work closely with other health professionals within the hospital and a variety of community support services. On average, we provide care for 200 patients daily. While we cannot control demands placed on our department by the volume or condition of our patients, we can plan for the quality and level of service provided to those in need. We strive to fulfill the mission, vision, and values of Chatham-Kent Health Alliance. To improve communication and educate those we provide care for, we have developed this video to explain processes and answer some frequently asked questions. We are caring people, caring for people. How do I access care? The first step to accessing care is triage. Triage is the French word for sort. It is a process by which patients' care is prioritized based on the type and urgency of their condition. Worst is first. All patients are triaged. A registered nurse specially trained in triage will perform a brief assessment to determine the reason for your visit. During this assessment, questions will be asked about your illness, injury, and past health problems. If this visit is a result of a workplace injury or illness, you need to inform us. Questions will be asked to screen for respiratory illness and infectious diseases. You will also be asked about allergies and medications you are currently taking. It is very important to bring current medications in their containers each time you visit. It is also very important to bring your healthcare insurance information with you, as this will be needed when you register. This information is required if you are admitted to the hospital. The nurse will be checking temperature, heart rate, respiratory or breathing rate, and blood pressure. This brief history and assessment will provide the nurse with a snapshot of your illness and will help to determine the priority of your care. A triage code based on the nurse's assessment and critical thinking skills and consistent with the guidelines provided in the Canadian Triage and Acuity Scale will be assigned based on the type and severity of the presenting problem. There are 5 triage categories. Level 1, resuscitation, applies to conditions that are threats to life or limb or imminent risk of deterioration. Level 1 requires immediate attention. An example of a Level 1 condition would be cardiac arrest. Level 2, emergent, applies when conditions are a potential threat to life, limb, or function. This level requires rapid medical intervention by the physician. Some examples of Level 2 are severe chest pain or extremely high blood pressure. Level 3, urgent, applies when conditions could possibly progress to a serious problem requiring emergency intervention. This may be associated with significant pain or affect one's ability to function at work or home. Examples of Level 3 may include moderate pain or mild shortness of breath. Level 4, less urgent, applies to conditions that would benefit from intervention or reassurance. Examples include minor injuries or illnesses. Level 5, non-urgent, applies to conditions that may be acute or part of a chronic problem without evidence of deterioration. Medical treatment could be delayed or even referred to other healthcare providers. Examples include minor bites, dressing changes, and medication requests. During the triage process, patients may receive first aid or be offered medication for pain control. It is important to notify your nurse should your condition change or symptoms worsen at any time. Once triage has been completed, registration staff will verify your name, address, and phone number, next of kin or emergency contact, family doctor, and health insurance information. You can expect to be asked about allergies and infectious conditions again during this process. It is very important that this information is accurate should the hospital need to contact you after discharge. Once triage and registration have been completed, your name, presenting problem, and triage level will be displayed on computer tracking boards within the department. From these boards, the staff will be able to track all patients registered in the department. These boards also inform the physicians and nurses about the number and acuity of patients in the waiting room waiting to be seen. They also relay other important information such as tests ordered, results, and alert the physicians as to who is next to be seen. It is very important that if you feel you are suffering from a severe, life-threatening emergency or illness, that you speak directly to the triage nurse upon entering the department. If your condition changes after you have been triaged, you need to inform the triage or your primary nurse. Depending on the presenting problem or illness and the assigned acuity, you will be asked to have a seat in the waiting room until it is your turn to see the appropriate care provider or be brought into an area for diagnostic tests such as electrocardiogram, heart tracing, lab tests, x-rays, or medication treatment. Once the tests or medications are completed, you may be asked to return to the waiting room. Those patients needing priority care or triaged as level 1 or 2 will be brought back immediately into the department for assessment and treatment by a registered nurse and a physician. People who require the most urgent care will be treated first. However, everyone will be treated as soon as possible. It is impossible for the staff to accurately predict how long you will have to wait. The emergency department is an unpredictable environment. Ambulances may be arriving with critically ill patients who need to be treated first. Ambulance patients are also triaged with the same scale as patients in the waiting room. Wait times are dependent on the number of patients to be treated and the level of care they require. While waiting, we ask that you be respectful of others in the waiting room, as they may be frightened or upset about their injury or illness. Respect one another's privacy and space. If this visit involves young children, we ask that you come prepared with necessities you will need to keep them comfortable and entertained. For example, formula, diapers, snacks, toys, etc. It is the responsibility of the parent or caregiver to maintain the safety of children while in the waiting room and at treatment areas. This department is a zero-tolerance zone. We will not tolerate verbal or physical abuse of our staff or those waiting for treatment. We appreciate your patience, and our continued goal is to decrease wait times and improve access to care. Why am I waiting? What happens next? You feel you have an emergency, and then you are asked to wait. People who require the most urgent care will be treated first. All other patients are treated based on acuity and as beds become available. We cannot accurately predict when it will be your turn. As well, you cannot predict who will be treated before or after you, as this is dependent on many factors, such as arrival of acutely ill or trauma patients by ambulance, the acuity of other patients waiting for treatment, the activity within the department or health professional that will provide the care to you. Once you have been brought back to a treatment area, you will be assessed by a nurse. The history and physical assessment done by your nurse is very important for providing care to you. We ask that you are open and honest with your care provider and are actively involved in your care. Critically ill patients may be assessed at the same time by the registered nurse and physician. Other patients will be assessed by the physician or nurse practitioner based on acuity and length of stay. Additional diagnostic tests may be ordered once seen by the healthcare provider. The timeliness of some of these tests varies. Some require a specific preparation related to the test. CT scans, nuclear med lung scans, and ultrasounds are facilitated by the respective department based on their patient acuity and volume. For this reason, we cannot predict how long you will have to wait for these tests. The history, physical assessment, and results of all diagnostic tests are important for the healthcare provider to diagnose and treat appropriately. When your healthcare provider is aware of your test results, a clinical decision will be made. You may be discharged, asked to stay in the hospital, or observed for a period of time. The length of time to observe varies depending on the time of onset of the condition or additional tests to be done. Some patients may be referred to a specialist, such as a surgeon, pediatrician, obstetrician, internist, or ophthalmologist. These specialists are on call. If referred to a specialist while in the department, they usually decide on your plan of care. We recognize the value of and support family-centered care. The relationships between patients, their families, and healthcare providers are important for information sharing. While our first concern is for the patient's welfare, we will make every effort to have family members present at the bedside and keep them informed of the patient's condition to the best of our ability. While at the bedside, we ask that family members allow the patient to speak for themselves if possible and offer additional information as needed. Be respectful of other patients within the department and stay within your family member's treatment area. For safety and confidentiality reasons, we ask that family members not linger in the halls or near the desk where the privacy of other patients could be invaded. We recommend that you designate a family member to act as a liaison with the nurse, physician, and other family members. It is difficult for staff to relay information to many family members at different times during the patient's stay. Please ask the nurse caring for your family member before bringing any food within the department or giving any food and drinks. Depending on the patient's condition, it may be unsafe for them to eat or drink, or tests may be delayed. Those who have experienced a fever, cough, runny nose, sore throat, skin rash, vomiting, or diarrhea in the last 48 hours are discouraged from visiting. To decrease the spread of infection, we ask that you wash your hands frequently. Alcohol-based hand wash is readily available throughout the department and waiting room. Outcomes and final decisions and follow-up. If discharged from hospital, you will be provided with discharge instructions and health teaching information relevant to your condition or diagnosis. A prescription for medication to treat your illness may be given. It is important to know that not all illnesses are treated with medication. Some viral illnesses require time to run their course and are treated symptomatically with rest, pain medication, and plenty of fluids. We encourage you to ask questions to help understand your illness or injury. Follow-up medical attention with your family physician or a return visit to the emergency department should occur if your symptoms or condition worsen. Our goal is to provide accessible, quality, and timely care to all patients who present to our department for treatment. The delivery of care is enhanced by your comments and feedback. If there are areas we can improve on, we ask that you provide us with your suggestions or observations in a constructive manner. The goal of this video is to provide our community with information to enhance their emergency visit and to answer some frequently asked questions. Thank you for your attention. We hope that you have found this helpful and informative.